So on the call today, we have two representatives. We have Chris, who's a representative for MedVia Tech in the Southeast US. He is a 23-year veteran in the medical capital equipment industry with specific expertise in lasers, diagnostic imaging, and channel management. And also on the call, we have Dr. Philippe Morris. Dr. Morris is a board-certified diplomat of the European College of Veterinary Neurology and also a diplomat of the European College of Internal Medicine. He is serving as the Chief Medical Officer for MedVia Tech. Let's welcome these gentlemen. How are you today, Philippe? Wonderful. If you wouldn't
I'm
mind.
doing well. I have to
Wonderful.
activate my micros. Yes,
It's
I'm doing
okay,
well.
no worries.
Thank
Good.
you very much, Jennifer.
Good,
Thank
good.
you.
Thanks for chiming in. We greatly appreciate your time today. Awesome.
So I see a question here, what are the advantages of air
Sure.
plasma compared to a surgical laser?
Yeah,
So I can answer or try to answer that question.
wonderful.
The air plasma, as Bill Culp alluded to you, is working at very low temperature, below 120 degrees Fahrenheit, below 50 degrees Celsius, which is very different than any sort of lasers or electrocautery. So there is no collateral damage when you use air plasma compared to these other devices, including surgical laser. The other biggest difference, surgical laser is very difficult to manipulate in terms of the depth of the tissue and the so-called collateral damage that is potentially happening. So when you use surgical laser, you have to be very careful at isolating the surrounding tissues that are potentially touched by the device during the procedure, which is not the case with air plasma. It's a very secure procedure. Let me give you a couple examples. You cannot use surgical laser when you work around the eye. You can certainly use air plasma because, with the use of surgical laser, you can damage the eye, eventually lose the eye, which is not the case with air plasma. You cannot use surgical laser when you work on oral cavity because you will then damage, the teeth, and you're going to damage the enamel. You're going to potentially have a lot of trauma to other tissues. It is not the case with air plasma. So again, there is a huge difference in terms of security and fine dissection and procedures that are not present with surgical laser. There's another difference also, is the cost. A surgical laser is a device that is within $35,000 to $50,000 at minimum, if not more. We're talking about here costs that are about half of that. So it is a very big difference as well.
Wonderful, wonderful.
I can see another question. Can this be used to cut on wet tissue? That's a very good question. That's another difference, particularly with electrocautery, but also with surgical laser. You can use air plasma in a wet tissue, in a wet environment. So that's one of the reasons you can use it, when you do endoscopy. You can use it when you work on the ears, like Dr. Culp alluded, when he was working on the total ear ablation. So when you have wet tissues and conditions where you have inflammation or fluid, you can work as well. Now, you cannot work within, a water environment because such as, inside the bladder where there's urine, because you need to create the glow. So you need to be with air in order to create the air plasma glow. But you can work in wet tissues, so-called wet tissues. Yes.
Wonderful, wonderful.
Are there any required maintenance contracts similar to a surgical laser? That's a good question too. I'm going to let probably Chris answer to that question, but I can give you a couple comments. Number one, there's very little maintenance with the experience we currently have with air plasma, and this is based on European usage and 5 years of experience. Very little maintenance. So that's something that we experience. Is there a contract associated with the maintenance? The answer is yes. There's a 1 year, a 2-year warranty. There's a 2-year warranty. And of course, there could be an option to have extended warranty or extended contract if you wish.
Wonderful.
I don't know if Chris wants to comment on that, because that's something that is more on his side than mine.
Sure.
Yeah, unlike the glass or the gas canisters with CO2 lasers or some of the other devices that would have consumables, replaceables, or whatnot. No, there's nothing. We have a 2-year warranty. The tips are rated for 50 to 100 uses, depending on the significance of the usage. They're autoclavable, and 2 handpieces come with it. So really, the only thing that would be replaced after a period of time would be any of the tips, but you have plenty of uses for that.
Wonderful.
I like the next question. Are all the components autoclave ready? That is very much the case. In other words, the handpiece is completely autoclavable, and so are all the tips. So it is a very convenient type of process and easy to use on a regular basis. Now, I just want to make a comment. You saw a soft tissue surgeon who's a specialist who's working in a referral hospital in a teaching institution. And of course, this is, one of the usage of the device. However, what we have seen in our experience with the distribution in Europe and now in the US is the fact that this is used by GPs. It is not a device that is limited to specialists. We see a lot of general practitioners are using it every day, whether it is on the skin or the anal gland or the ears or the eye. I mean, you're talking about a device that can be used by general practitioners. And again, this is something that I believe is a true benefit.
Some of our recent users that have used it over a year comment on the versatility and ease of use. It still is precise as some of the other devices, but it is extremely safe. There should be no doctor in the clinic that is hesitant to use. I've sold CO2 lasers before, and they can be each device requires training, but there is a certain hesitation sometimes from some doctors in a clinic to grab the CO2 laser because they hadn't been trained. The plasma energy created at the incision site is only activated once the target tissue and the tip approach each other on the order of about 1 millimeter. So the foot pedal can be depressed, it can be activated, and it can be it only engages when you start to cut. So it's extremely safe. And then the other comments are all the really, really common lumps and bumps and the things that are seen in a small animal companion animal clinic. It's much easier to grab this device as opposed to scheduling a more significant surgery that may have more downtime, more anesthesia time and such. So it's very convenient and easy to use and cuts a lot like the other devices, but much, much safer at 120 degrees. Cold plasma is an efficient cutter at that low temperature.
Wonderful. There's a question relating to safety wear. Viewer would like to know, do they have to wear safety glasses, or if there's a specific type of glass for the covering their eyes?
No glasses.
Can I answer that? Yeah, no glasses are needed. And no return plate, no glasses, needed. Another thing that I want to mention is that, veterinarians have a tendency to forget that the fumes that are generated by electrocautery or surgical lasers are carcinogenic. In other words, they can be damaging for the surgeon and the staff around the surgical table. And the studies that have been done with air plasma show that it's not toxic and not carcinogenic. So that's another advantage. I just want to also make a comment that was mentioned by a very famous soft tissue surgeon and ear, nose, and throat and dentist, Mark Smith, who's based in Virginia. And he told us about a year ago that if he had the air plasma device before he bought the surgical laser, he would not have bought the surgical laser because, he believes that it is better and more precise and less dangerous in his hands. So another comment that I think is important to point out.
Wonderful. We have a couple more questions, I believe. This one is the device iodized for oncology? Or I'm sorry, indicated.
Yeah, there's another question related to the evacuate arm from smoke. So I think I answered to that. It's not carcinogenic. However, some people are annoyed by the smoke, and there are some smokes and fumes that are generated. So it is not really needed, but sometimes some people prefer to have no smoke at all. So if you already have certain device to evacuate the smoke, I would advise you to continue to use it, but it's not necessary. It's not mandatory. Now, in terms of oncology, that's a very good question. I don't know if you noticed, but Bill Culp is very much engaged in oncology surgery. He did all kind of studies in oncology, and it's one of the reasons that he likes this device is because it is very much used, in circumstances and conditions that are related to cancer. There are certain studies that have been published, and if you are interested, we can send them to you, that show that there is an anti-replication process due to the air plasma in certain cancer cells. In other words, it seems that in certain cancers, in certain tumors, the air plasma itself, other than removing the tumor, has an anti-replication process that is beneficial in oncological patients. So yes, it is very much indicated in oncology.
Wonderful. All right, we do have a couple more questions. If you'd like to go through those as well, please feel free to answer them. And then, ladies and gentlemen, we just wanted to let everybody know that sometimes with the questions we get, it does kind of allow a speaker to go over. So we're just going to allow the speakers to answer all the questions, and then we'll proceed with our upcoming presentations. Please continue, doctors.
Yeah, sure. I can answer to those last questions, and please, Chris, add on to it. I haven't heard from this before. Yes, this is quite new, innovative. This came out in Europe about 4 years ago. So it is, and it started with veterinary medicine. However, in Europe, the device is now CE approved for use in human. So it is not only used in animals, but it started with animals, which is sometimes the opposite. It starts with human and it goes to animals after. In this case, it started with the veterinary device. Now, yes, operating at low temperature translates into better healing, and there's several studies that show this very clearly. So if you think about it, protein are destroyed with temperature that are, above 50 degrees Celsius, 120 degrees Fahrenheit. If you work under 120 degrees Fahrenheit, you don't destroy the protein that are associated with the tissue. In other words, you increase the healing time and you decrease the inflammation. So better healing and, less pain, that's one of the true benefit of air plasma. And actually, it's interesting because the baseline of one mitis in Europe is healing starts at the incision. Healing starts at the incision. That's their baseline. So yes, it does very much translate into better healing.
Wonderful.
Chris, anything else?
One last comment, as long as there's maybe another couple of questions. Understanding that this is new, it's exciting. I was very excited to start working with this over a year ago in the United States here, and the response has been amazing. But understanding that everyone that's looked at it understands this is a new technology, and the benefits are far outweigh any other devices out there. It's got all the benefits of what you're used to cutting without a scalpel or with a scalpel, and then at a low cost. But understanding that it's new to the market, we are available to come to your clinic and show it to you. We can do it virtually, we can do it in person, and we can schedule surgery so that you get a chance to use the device as well.
Wonderful. What a great offer. All righty. So I believe that our questions seems dissecting better. Okay. I believe we got all the questions, gentlemen. So we do have a lucky winner of your raffle item. And MedVia Tech is raffling off a $100 gift card. So for everybody who is logged in to watch this wonderful presentation, The winner will be Allison Kennedy Benson. Again, Allison Kennedy Benson is the winner of MedVia Tech's $100 gift card. So again, if you would send us an email to info@dvmcentral.com. Please put in the subject line raffle winner and then via VIA Tech TECH, and then provide us with your first name, last name, and mailing address so we can send this to the wonderful gentleman.
Congratulations.
Today.
So last question,
Congratulations.
real quick. Yes, it is cutting
Okay.
through fatty layers. Yes, the answer to that last question.
Somebody
Go ahead.
second. Good,
Yeah.
good. Wonderful. Anything else you gentlemen like to add today?
She's here. Yeah.
Well, we would like to thank DVM Central and thank you for having
Yes.
us today, Jennifer and DVM Central team. That was great.
Thanks
Cool.
to everyone.
Thanks for coming in. We appreciate it.
Take care.
Bye.
Yeah, thank you. Bye-bye. Have a good day, everyone.